Now we hand over to you guys and your experiences as consultants, and hopefully you guys will have very invaluable insights to share with us all.
Just to let Mr. Shah and Mr. Basnet know, we have people joining from India, Nepal, even I think looks like might be Bulgaria, and people have registered from other countries like Libya and so on. So yeah, Mr. Basnet, do you want to go first?
Thank you, Natasha. Thank you, Ashish. And first of all, congratulations to you guys. I mean, you've done a wonderful job, and I think this is a really, really good platform. I did join earlier, listen to part of it, and then I sort of joined a bit later to join as well. And I really sort of applaud and thank you for doing this. This is excellent. Ashish didn't warn me that he was going to take a picture. I would have come a bit smarter, right? Sort of a journey-wise, I mean, it's amazing. I was just sort of thinking, I think I've known Ashish since his SHO registrar days, so it just tells you how long I've been. To be honest with you, I was sort of reflecting on my own sort of a journey, apart from doing medical school in Calcutta and then working in Nepal for a year before I came to UK. But I did do a clinical attachment as well. And I did a clinical attachment for 6 weeks. And I remember that it made a huge difference for me to understand how the NHS works. And to be honest with you, although I knew English, it also made me understand how English is spoken in England, if that makes sense. Because it's very different to how I was brought up. So I think this clinical attachment did help. And I would still recommend people that if you do get a job or you're looking for a job, this clinical attachment does help. And things have changed so much since then that I think it's become more essential to do that. I started my life in St. Peter's in Chertsey, where I did my A&E. Those days, we used to work something like 126 hours a week. You know, so that was the time, and that was supposed to be norm at that time. Then I did my SHO in orthopedics in Southend-on-Sea before I went to Wales to do my surgical training. So I'm a fellow from Scotland. That's where I did my fellowship from. Wales taught me a lot. I was part of what's called the post-Calman training. So I was part of the training program. And I also got a few sort of awards to go to America, and I did my traveling fellowship from Cleveland Clinic in Fort Lauderdale, and I went to University of Southern California in LA. And I worked with some of the well-renowned people who I used to read their books, so that gave me an insight to how the system across the Atlantic worked. So that was quite useful. I was appointed. Then I was appointed consultant William Harvey in 2001 and started my job in 2002. So I don't know where you guys were during that time, but that was a long, long time ago. And it was difficult. You know, consultant jobs are challenging as well. I did a college tutor job. I've helped loads and loads of people doing clinical attachment, work experience. And over a period of time, you can imagine that I've got lots of trainees who've been through us or medical schools who've been through us who are hopefully going to look after us, you know, when we retire. Now, during our time, most of the learning was learned on the job and was also learned. We didn't have, you know, protocols, guidelines as much as you do now. We didn't have, you know, so much support as you do now. But especially when you come from abroad, and people have different cultures, different educations, different ways of thinking, and that takes time. And I've always felt that you know, something like this should always happen. And I'm so pleased that it is happening. And that's sort of in a nutshell. I'm currently also I'm still practicing as an active surgeon, as well as I've got quite a bit of my managerial load as associate medical director for the area, and I'm also the colorectal cancer lead for the region. But those remits is something I'm hoping. The reason I'm saying is not to sort of boast who I am, is hoping that some of you may be able to capitalize on where I am, so that you can use if you want to do research, you want to go into networking and all, and I would be able to direct you on that line. So that's the only reason I'm mentioning these. And I'm hoping to take any question and answers as it comes through. But well done again, and thank you.
Mr. Shah,
Yeah, I think I'll go next. Can you hear me?
we can, yes.
Perfect.
Yes.
So my CV is not as long as Mr. Basniak's is, but thank you very much for the wonderful opportunity, Ashish and Natasha. And it's a privilege to join this group. And when I see all you youngsters there, it feels I just turned back 25 years when I came in first. And I am absolutely sure you all are apprehensive and anxious about how to get in. What I can tell, one, is that I wish such a course was available when 2000 when I came in first. My journey has been a little step gap arrangement where I have come in here for 10 years after doing my post graduation in India, then went back home for 8 years to practice transplantation, and I'm back in the UK for the last 7 years. More than me, I think you want to discuss about the questions and answers. I do a lot of research, audits, presentations, but that's all separate story. As Ashish, as Mr. Shrestha mentioned, that it is a bit difficult, but it's not impossible. I would only say, going on to Mr. Basniat's thing about English, I remember my first two experiences when I did a clinical attachment. We all know as medical students that when there is a wound which is dirty, you get something called a slough, SLOUGH. And when I first came in, unfortunately or fortunately, my first course was in a place called SLOUGH. So I told my consultant I'm going to slough. And he laughed his way out. He absolutely laughed his way out because in UK, UGH is generally silent. It is actually called Slough. And I had taken the exams from Edinburgh. I'm intentionally saying Edinburgh right now because that's exactly what I pronounced it when I first came in. And all I'm trying to say is, in spite of these nuances in English, I'm still where I am. And I think I've done all right to be a consultant here. That just tells you the opportunities that you have. So please don't get restricted in your mindset by people who have not had such great experience about jobs or have not had a job yet. This is a very open country and everybody's welcome. It is extremely competitive. And as in Nepal or India, you wouldn't want somebody else from other countries to just come and take up your jobs. It's a similar situation here. But don't worry about that. There is enough for everybody. You just have to continue to try to work hard. I would say that one of my ex mentors had told me this, that we are generally, as doctors, you are the top 5 to 10% of both the academic brains and financial brains. And you have reached a stage of passing MBBS or post graduation, wherever each one of you is in your step, which means you're still in the top 5% of the world. So never undermine yourself. You want to get on and come back to the UK or move on. But if ever you go back in your inspiration or encouragement or motivation, just think that I meaning you individually, are in the top 5% of the world. So what is stopping you? There are generally some rate limiting steps. Try to overcome all of those. I would only say one thing is get a mentor, get somebody who will help you every time. You have Mr. Shrestha, a lot of us would help you. It doesn't have to be a consultant. It could be a senior person, a person who's working here, who can guide you to every step. Because sometimes we all aim in the blind, and we all aim in the dark, and that's not something I would recommend. So get a mentor. Don't undermine yourself. And I'm very happy to take any questions from our experience that you want to use us for. Thank you.
Thank you, Ankur and Mr. Basnet. As you know that, see that Mr. Shah is also a motivational speaker. He motivates the department in different ways. We also have Dr. Arti Hamal, our chair, Dr. Arti Thapa, our chair of ND UK. Do you want to tell us about your journey in UK, Dr. Thapa? Is she here, Dr.? No, I think.
Can you hear me? Can you hear me now?
Yeah, we can hear you.
Yeah. Hello, everyone. What a fantastic morning and conference, Ashish. Thank you for hosting and organizing and all the participants. Dr. Basnet, I know, and hello, Dr. Shah. So I am Aarti Thapa. I came to UK in 1996, obviously a long time ago. Can you believe when I first came to UK, I did not even know about what general practice was because it was not something I had heard in Nepal. Everything was a speciality, and when I was offered, there was a three severe deficiency and in three specialities where the government was looking for jobs and doctors was psychiatry, pathology, and general practice. And when I went to the deanery, when they said that, look, you need to, we are going to, there is where the vacancy is. You are going to be, because I was going to be training part-time because I had very young family. I had to go and look at what was general practice. And I just then suddenly dawned on me that I need to be knowing everything. And that was daunting. However, I went into the training scheme and I did training in London, Essex, and Yorkshire because I had not done any work in Nepal. I came straight after my house job. I finished my house job, and the next week I was in UK, did the PLAB, IELTS, and everything. So after that, I went into training, and here I am 23 years later. I've done virtually every role a GP can do, from portfolio GP, salaried GP, locum GP, GP partner. So now I'm a GP in London, and one of my major interests is end of life care. As a GP, as you know, we provide quite a lot of things, the end of life care, and that is palliative care is one of my really interested area. And I do a lot of women's health. I do a lot of contraception, family planning, and I do a lot of primary training to paramedics, pharmacists, and physician associates. And I am a GP trainer, but my practice has got so many supervisors that I'm just supervising more the F2s, but have got all the qualifications and training to supervise the STs as well. So general practice, very challenging, but very interesting as well. And I've not enjoyed this. I've enjoyed it every day. And hopefully a lot of you would be coming and filling the gaps that that UK at the moment needs, nearly 6,000 GPs. Thank you.
Thank you, Dr. Thapa. I think the credit for this whole webinar goes to Natasha, Matthew, who have been leading it, and Simos, Chitiz, Avi, the other people who is working in the background, Sagarika, Sasa, Abhishek was there before. So the credit goes to them. Simos, a question to the panel, please.
Can you guys hear me?
Is there any question to the panel? That's the budding question from the panel.
Yeah. Thank you again, Mr. Bass and Mr. Shah, Dr. Thapa, Mr. Shrestha, for joining us today and contributing your time on a Saturday. We really appreciate it. Just a few questions that I would like to ask on behalf of all the IMGs, from your experience on, taking on attachis. So what are some positives that you've seen an IMG do that's, stands them out on in your perspective? And what are some common mistakes that you see IMGs make that you would recommend that they avoid as someone coming into the NHS as the first time?
Uncle, do you want?
So, yeah, hi, Simos. Thanks for that. I mean, if I understood the question right, is the clinical attachment is the question you're asking? Is that what you're asking?
It can be clinical attachment. It can be someone doing a trust grade role, just someone who's coming from abroad, in terms of like how they settle into the NHS. Like, what are something that stands them out? What are some positives, and what are some mistakes that you see them make that you would recommend going about a different way?
To be honest, most of the IMGs are quite intelligent and motivated people. All right, they're highly intellectual and motivated, and by the time they get into either the clinical attachment or the jobs, I find them that they have done due diligent work. They've understood the NHS in some way or the other form. Okay, but there is always room for improvement. Okay, there's always room for improvement, and seminars like this, and I believe the BMA and the GMC also provides a similar sort of a support as well. Any of those to take. Understanding the local trust induction program, the policy would help as well. Understanding the local department they're trying to work, and working with your colleagues would definitely help. And I don't think I mean, obviously people are a little bit sort of timid and shy when they first start off with, but I think Mr. Shah sort of mentioned earlier is that everybody is welcomed, right? So make sure you are confident. You present yourself the way you are, not overconfidence, and there is no shame to say, I am sorry, I don't know the answer, or can you help me? Absolutely, there's no shame to do that. And it is much better to ask that question well in the beginning. And most people who come from the cultures I come from, we find it very difficult to ask those sort of questions. And I think that's the barrier, where you should be able to say, I don't know, I'm sorry, can you help me? I don't understand this. And even if somebody gives you an instruction, if you're not understanding it, you can always ask that question. So those I suppose, is where you learn over a period of time. But if you can catch this earlier on, I think it becomes a much smoother. Um, Earlier on, I think when I heard that there was, the challenges, the difficulty and all, that's always been there. I mean, I came to 1993. We always had the challenges then. The challenges are always there, but they are different. So don't think people in the past have had a cushy life, or the people in the future will have a cushy life. The challenges will always remain, but they are different, and you have to make sure you're prepared for their challenges. Thank you.
Mr. Shah, anything?
Yep. Thank you, Samosh. And what a wonderful question you've asked. And it should resonate and vibrate with all the IMGs, this question. And all I can see is I had the opportunity of 2 minutes when Mr. Basnet was speaking to make a few points. We do take a lot of clinical attaches, including myself, and I have the privilege of sharing office with Mr. Shrestha, so he has a lot of attaches. What I would say is the following points. I made the points. I'm assuming all IMGs are listening. Do make these as a notification point, because I have made this from my experience of handling. When you come in, the first thing Mr. Basniat said is challenges. Don't worry about them. Everybody, and as he said, we've all gone through this hard phase. So you're going to go through as well. Life is much greener on the other side once you get a job and it happens. When you come as a clinical attaché, number one, please ensure your dress code is appropriate. And what happens is, I come from a place which was, we were working 24/7. So we used to wear sandals on the wards. We would wear denims stroke jeans on the wards. Don't do that. Use the trust policy. The most irritating thing, because remember, you're not working only with me or with Mr. Shrestha or Mr. Basniat. You'll be working with the nurses, paramedical staff who may take an objection. First impression is last impression. Second is body language. Use your words carefully. Choose it. So dress code. Second and more important is, let's say, for example, you are attached to Mr. Basniat. Please just don't be attached to him. There is a department of 11 consultants or XYZ consultants, registrars, SHOs. Please go and speak to all of them. If at all, Mr. Basniat would be the least important person there. He's just giving you a door to enter the system, and he is busy. We will all have our operating endoscopy clinic list. Please go to others. Third and most important is, once you have understood a little bit of the ward structure, the clinic structure, to be honest, that's not exactly what you're there for. You have to keep your hand on your heart, and you're looking for a next job. You're looking to enter. So please straight away get on to some audit, a quality improvement project, a teaching session. At least I know our trust is very good at it. Most trusts would help you do that. Stick to some F1 registrar, but your aim and your only target when you do a clinical attachment, after understanding a little bit of the NHS, is to get your CV enhanced. Nothing works better than having an audit of QIP from UK rather than from Nepal or India or Bangladesh or wherever you are from. is because it carries much more weightage. Whether we like it or not, we feel that it is a much more honest work. Get out of your comfort zone and speak to people. Thankfully, most no, all trust have a variety of individual cultures. So they all understand if your accent is a little different from somebody else. Mine is still different. I still don't understand my white colleague nurses or something, but they will always emphasize it. It's a beautiful system to enter. You will be most welcome as long as you are as friendly as they think you will be. And last is whatever you do, wherever you progress, you'll have some contacts. There's a very nice saying in motivational speech: your net worth is networking, or networking is your net worth. And I think Mr. Basniad made a point of it as well. So keep your networking going. So if you are with Mr. Shrestha today, 5 years later, do send him an email saying, "Hi, Mr. Shrestha, how are you?" It just to keep in contact. You never know when people come back to help you. As I said, I just give a simple example. I went for my clinical attachment to a place called Royal London Hospital in 2000. When I came back, I used to just, because I was a transplant boy and he was an HPB boy, we used to just say hello and happy Diwali. That's our festival. So happy Diwali every year. But when I came back, all I had to do is tell him that I've come back, and he said, "I've got a locum consultant job somewhere. Would you like to take it?" It just helped. It just made my life so much easier to come back. And that's when I'm saying, do not leave your net, including when you're back home. So do not miss out on your old professors or consultants. And that's where. So I'll summarize: ensure dress code, body language. Please work as a team, go to everybody, and get on to your portfolio. Hope that clarifies. Thank you.
Dr. Hamal, Dr. Thapa, Dr. Thapa, I always.
I think in the same, a lot of things both of you have said is, um, uh, resonates even with our trainees in general practice. I think one of the thing, dress code is very important. But luckily nowadays, most of the GP trainees and doctors are wearing scrubs, as you know, in general practice. So, but still, how you dress the other time is equally very important. One of the thing is, on top of that, I would like to say is that what we would really people like is the professional curiosity. The curiosity is very, very important because when we see trainees, some are just sitting there and just listening and not coming forward, and whereas some trainees who are very curious, they want to do something, they want to ask something. Oh, how does this work? Simple things like what are the leaflets you are displaying in the waiting room, can we add something like that? It just gives people some sort of think that, look, this is a trainee who is actually quite interested, she has suggested something. And in general practice, there is every suggestion counts and valued. And that is the type of trainee who really stands out to me, on top of all the other additional qualities that we mentioned: the enthusiasm, the professionalism, one with communication skills, the adaptability, everything. The curiosity is the part that stands out, really.
Yeah, I think that's really important to come out as confident but not arrogant.
Yes.
Clear English, and like we said, we try to learn the pronunciation, different kind of. My son even teases me now because he's studying in the UK schools. He teases me every time I pronounce something different. That's probably what happened. Now, another question, Simos. Do you have another question for the panel?
Yeah, so it's just another last question that we'll ask, and then we'll take the questions from the floor. So this is just a generic question, as in like how. So if there was any times in your career that say you had a setback, or you were really applying for a job that you really wanted and you didn't get. How do you? I mean, you've got a lot of experience now as consultant, and like, how do you think you handled your setback, and what was your recommendation for someone who's going to go through a lot of setbacks in their career as IMGs? a lot of hurdles. What are your recommendation? What did you do, and what would you recommend? That's my next question.
Right.
Uh,
I'll go first so that it gives Mr. Shah time to write his notes. um, Good question. All right, good question. And I think this sort of a question is not only for medicine; it's for any career you do. Whether you go for banking, you go for computers, you name it. You're always going to have your ups and downs and all. And I suppose how you deal when it's down is going to be the same for every sort of a profession. Um, Now, I sort of have been slightly lucky. At the same time, there have been disappointments as well, which does happen. Um, and I remember when you asked that, so was going through that question, that the hospital I was working in back in 1993, 94, I was doing A&E, and I was so confident from my consultant that I would get an orthopedics job there. So I went and met the orthopedic surgeons to get an SHO job. So it was an informal interview in the canteen, and I sort of came back quite demoralized because the person basically said there are too many doctors applying for it, you've got no chance and stuff like that. So it was demoralizing, but I didn't give up and I did apply. So I ended up getting in Southend-on-Sea. So yes, I did have to move. During my training, I worked with Professor Peeling. Professor Peeling is a pioneer in TURP in the country. So I was an SHO then, and I was quite keen to be a urologist for some reason. You keep on changing your specialty. So Professor Peeling put me on the side and said, are you prepared that there is a lot of competition? And how is your heart really in urology? I thought for a while, and I thought, you know what? I don't want that sort of a competition where I could be disappointed. Because at that time, there was a huge competition as well. So that was a bit demoralizing as well. But then I was able to sort of think, do I really need to do that? Is the competition worth it or not? Okay. So you have to analyze and reflect on it, and then you prepare for the next journey. And I always, when people ask me this question, it's like playing sports, and it's in tennis. You see a lot of good players, they do lose, and they go back, they analyze their shots, they analyze their game, they come back and they win. So it's the same principle, is that if you are not successful on what you're getting, go back, reflect on it, analyze it. Is this right for you? Am I thinking realistic, or do I need to change my tack? So those are the things you do need to do. And if you do it in a methodological way, you will prevail. You will get there. And more or less, that's how I have used in my career. So, and to be honest with you, don't think for a minute that once you become a consultant, absolutely everything is green and you're fine. You will still have those issues going through as well. And you'll still have to go through the challenges, and you'll still have to go through that process. And you will be in a very low in your graph, and you'll sort of come up. So those things will keep on going. That's part and parcel of the job you and I do as well. I'll stop there.